commitments.
The honourable member for Cape Breton Centre. Pardon me, Cape Breton Richmond.
Thank you, Mr. Speaker. Mr. Speaker, my question is directed to the Minister of Health. It is difficult to believe that the Minister's Department is concerned for the health and well-being of all Nova Scotians. It's also difficult to believe that the Minister's Department and the NSHA ensures that those that are ill and most vulnerable are given every opportunity to heal, and that those at the end of their lives can do so with dignity and respect. Mr. Speaker, on numerous occasions, the Straight Richmond Palliative Care Society and the Richmond County Seniors Council has submitted a proposal that would see that at the end of their life, people would do so with support and resources that they need either at home or in hospital, something the Minister's Department promotes. They've even written to the Minister himself on numerous occasions for the last 2 years, and the most recent on September 22nd, which was a handwritten letter. Mr. Speaker, I ask the Minister why the Health Authority and even the Minister do not feel it necessary to respond to the concerns of my community through the correspondence sent to both the current Minister as well as the previous Minister of Health.
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. Indeed, Mr. Speaker, we do know, and I want to pass my condolences on to the member. I know there has been a recent loss in the member's family. But, Mr. Speaker, the question of end-of-life care has come up a few times this session in estimates debate here in question period. At a number of occasions, and as I've mentioned, indeed there's been a significant amount of work done by my predecessor, the current Minister of Community Culture and Heritage, and the staff across the Department of Health and Wellness to establish, which is really in relative terms, a new or emerging area in the healthcare system is end-of-life care, and recognizing that work. So a framework has been established to establish hospice programs to ensure that communities that are interested in this type of service have a consistent approach to be looked at when these discussions take place. Thank you.
The honourable member for Cape Breton Richmond.
Mr. Speaker, I heard the Minister earlier say value, not the dollars. These people do not equate to dollars and cents. My father, and thank you to the Minister, I thank the Minister for his condolences. My father rapidly progressed through a disease that brought him quickly to the end of his life the day before I was supposed to take my seat in this legislature. Even though Dr. Robert Martel had resigned as a palliative care physician, he supported my father and our family through this difficult time because he's a family friend. He was able to reassure my father and inform our family of the steps that would have to be taken in the days that led to my father's death. I thank the Straight Richmond Hospital staff for the palliative care my father received outside of any direct support provided by the Nova Scotia Health Authority and the Minister's Department. Mr. Speaker, will the Minister finally commit to meeting with concerned groups in Cape Breton Richmond that have been trying to get a meeting for 2 years regarding palliative care? Let's stop with the talking points, let's stop with the rhetoric, and let's just get a yes or no will suffice.
The Honourable Minister of Health.
Thank you, Mr. Speaker. And again, I believe this question came up earlier this week or late last week, and a member actually on behalf of another member in the PC caucus. I believe there are 2 or 3 communities that this question, actually I believe it was the member from Cumberland North that raised this question as well. And indeed, I took the information about them to bring forward as far as bringing the meetings together. Of course, I made reference in my previous response that the framework exists. That's to allow those discussions with the staff and those organizations to allow this to move forward, Mr. Speaker. And so again, that information, those requests is coming through. So as I've just said, Mr. Speaker, again, the opportunity to meet and have those discussions is in place, Mr. Speaker, as well as the framework to allow those discussions to move forward in a meaningful way and an efficient way.